Flu shot mandates. We want to have an open, transparent discussion here regarding our concerns. Flu shot mandates and healthcare mandates in general. We know that now is a time of year where the flu shot becomes a thing. Flu shots are being encouraged. We'll talk a little bit about that. And we really want to focus on the ethics of mandating flu shots. What we're about to say is not any direct medical advice. Obviously, everybody needs to make their own decision with regards to what to do according to their own history. We are going to talk as transparently as possible, as we always strive to do. And for anybody who enjoys our discussions, please check in the link down below for our separate, unique Doctors of Ojai channel, where we post a lot of unique, exclusive content. All right, let's dive in. Dr. Ben, do you want to get us started then on this topic? Flu shots and specifically shot mandates.
Sure. Well, it's that time of year, so people are going to be going to their primary care doctor's offices and clinics and other places, and they'll be offered the flu shot. Now, what we're talking about here really is the mandate. So if you work in healthcare and you work in a hospital or you work in a clinic, you will likely be mandated to receive the shot in order to continue practicing. What we're talking about today is really the ethics behind that, the appropriateness of that. And the reason we bring that up is multiple things. Should you be allowed to mandate that, or should it be appropriate that you mandate that someone has to receive a certain intervention? That's one thing to talk about. And two, is this intervention effective enough to be considered something that should be mandated?
That's correct, yes. And flu shot mandates are in place across the country. We're in the United States. And there is a way that anybody who doesn't want to get one can decline. We'll talk more about that in a moment. But let's talk first about the effectiveness of the flu shot. And again, we encourage everybody to make their own decision, what's best for them. But it's important because the way the mainstream media and medical establishment talks is sometimes giving the impression that this is 100% effective and it's all that anybody can do to raise their immunity. Dr. Peter.
It's so true. So as a cardiologist, I look for really hardline evidence that I know that this treatment per se will have a benefit on my patient or they will have a good outcome for it. And a lot of the studies I've done on flu shots are observational studies as well and not necessarily hardline evidence. And again, what it comes down to is that whole blanket medicine where one size fits all. And I think that's the problem I have with the most with the mandation is that not everyone is going to benefit as other people. And there are populations, obviously, that will benefit. It's up to you to decide and talk to your doctor about. But it's, again, just like a lot of the guidelines we talked about, you're forcing a guideline that will work for one patient, but not necessarily for another.
That's right, yes. And specifically within healthcare, is there any strong evidence whatsoever? So whether you are a doctor, nurse, any type of other professional, the question is this from an ethical standpoint, is that you have an intervention. Is there strong evidence that it will protect you? Is there strong evidence that it protects other people? Or are we simply fulfilling tick box medicine? And ultimately, do we violate informed consent and patient autonomy? Because I personally have very strong feelings about saying, well, you have to do something just because it sounds good when it's not based on strong evidence. What do you think, Dr. Ben?
Yeah, the idea behind it is that healthcare workers, for example, are seen often immunocompromised people in the hospital. So the idea behind it is that if they can mandate the shot so they don't spread it. Now, with a shot like this, you have to look at how effective it is. And in low years, it can be as low as 20 to 30% effective. So that means it can still spread very easily. So are you actually protecting the population that you're discussing through doing this? And is that high enough to say, okay, everyone has to do this? Without question. The other issue is if you are ill from a respiratory virus or any other kind of infection, you should not be going around immunocompromised people and you should not be coming to work. So, I mean, that's understood with every other virus that is out there. And for example, we don't have shots against many of the other viruses that people can bring in and infect immunocompromised people with. This is opposed to shots against viruses that caused almost 100% immunity. So we have things like polio, that if you got the shot, it was an effective shot. It caused lasting immunity. It prevented the spread. So that made sense. But what we're talking about now is a very different kind of shot and really cannot be held to that standard at all.
Yeah, no, I think those are good points. And isn't it the case that the flu virus rapidly mutates, and when they make the shot, it's from an older version already? And don't they look at Australia or Southern Hemisphere first to try to predict what's going to happen? How do you feel? So I will tell you this. So I will talk about my own decision in a little bit to decline this and why I did it. I made some content on that before, but I have many vulnerable people, even in my own life, relatives who look at the same evidence and they decide, yes, they want to go ahead, and they've never had any issues or side effects, and they take the shot, they decide they want it. They may be above the age of 75, for instance, or maybe have respiratory conditions. The vulnerable groups who should be targeted more is one thing, correct, for an intervention like this, but having sort of a blanket statement saying a healthy, say, 21-year-old who is, say, a new nurse has to get it to prevent an issue. And I've encountered many people who say that they've had issues, they've got side effects, and they continue to get them every year, but yet they work in healthcare and it's mandated. What is the evidence? Is it there? And the studies as well, Dr. Ben, 20%, 30% effective. I would counter that. We saw that during the pandemic, is that they make these types of studies. And when you actually look at number needed to treat and other factors, which I wish more doctors were actually clued in on, it's not that impressive at all how they get these even 20% effective figures.
That's absolutely correct. And what we see is with this shot, as well as with during the pandemic and that shot, what they tend to do is move the goalposts. So if it doesn't prevent disease and it doesn't necessarily prevent spread, well, it prevents hospitalization. Well, it prevents death in the hospitalization. Well, it prevents severity. So it keeps moving the goalpost. And that's, you don't have to do that with the very effective shots, but you do have to do it with the ones where the effectiveness is somewhat questionable.
It is, and it's amazing if you think about the 20% effective rate. If you were given a medication and told it was only 20% effective, would you consider it? That's something to think about.
It is, yeah, very well said.
We know in cardiology, intense immune activation, which sometimes happens after shots, and we've seen this a lot after the pandemic, increases sympathetic drive to your heart. So people have increased blood pressure, increased heart rate. People who have arrhythmias, like atrial fibrillation or get palpitations, awareness of your heart beating. I've seen many patients who have had shots before who have an increase in symptoms. So there is definitely something. It's not, I think we all grew up in society where we just thought that was just part of your routine yearly. And it was really in the pandemic where we really had to think about what is best for us. And it's getting rid of that whole algorithmic blanket medicine.
Yeah. Well, I think we're all afraid to talk about it. So I think ever since the pandemic, where now it's all coming out, that there was enormous pressure on doctors and individuals to be very careful with what they said. And as a matter of fact, you still have to be very careful with what you say, or you will be blacklisted and shut down and have complaints made against you simply for asking questions. And that still exists. And it now is focused around really any medical intervention that is kind of pushed by the mainstream medicine or the academic facility. They'll push these interventions. And if you question them and begin to ask, are they truly effective? Is this something we should be doing? You catch enormous pushback. And with this shot, if you even bring up that you're not so sure, you want to talk about it, you have some questions, you immediately catch an enormous amount of pushback, attacks, really.
Yeah, which is an utter disgrace. And yeah, unfortunately, there is this culture of people being afraid to speak up, doctors being afraid to speak. And to me, that goes totally against what medicine should be about from what I would call mainstream establishment doctors. Of course, we are not afraid to speak up at all because we believe in what we're saying. And we think, absolutely, if medicine and science is not about asking basic questions, it is not enough. It is a disgrace. If anyone watching is a doctor or in any sort of administrative capacity, It is utterly shameful that you will promote something without good evidence and you won't be fully transparent, which is a good segue on what I want to talk about next, which I know Dr. Peter is big on. You will see many people, even in the mainstream media, they will say with the flu shot, and again, we're not saying the flu shot is something nobody should ever take. We've all taken flu shots before, but what I'm saying is be honest. You will see the mainstream media and even top doctors say, this is the best thing you can do to protect yourself from a virus. Those same doctors will never talk about all of the other things people could do, but it's only this. It's so one-dimensional. And this is why the current medical paradigm is going to fail, because people are waking up. Dr. Peter, I know you have a lot to say about that. Everything people can really do to improve their health.
Go back to your point, Suneel, is that you should ask your doctor or whoever is prescribing or telling you to get the shot or the flu shot is why, or like, what is the benefit to me personally? And that's my bigger picture here, is not necessarily the flu shot itself, because you're right, there are lots of patients and there are patients that will benefit from it and should have it, but it really is, why do I need to get it personally? And that's something that you shouldn't talk to your doctor about, because no one else will if you don't do it. And a lot of doctors may not be able to answer that question too. So here's what is not mandated, which is kind of crazy, is a healthy lifestyle. Like, why not tell people that they need to have their vitamin D levels raised?
Mm-hmm.
Why not tell people that they have to cut back on processed foods? We know that people get sick not from catching a bug from someone you just walked by. It's that your immune system is down for up to 30 days before, because people aren't exercising regularly. They're not keeping up with vitamin D levels. They're not keeping up with eating clean, fresh food and avoiding pro-inflammatory foods. And I guarantee that if everyone in the population had focused more on this and puts more emphasis in the mainstream media of bringing awareness to this, that flu rates would probably drastically drop without any shots.
Okay, everyone, I'm going to interrupt that awesome discussion for a moment to tell you about our expanding natural health and well-being store. We are very proud of our expanding store. We have natural immune inflammation support, bone support, memory support, heart support, sleep support, and our newly released premium organic lion's mane and organic chai mix. We've got some great reviews so far. Check in the links down below. ohighwellness.com if you're in the USA, North America, ohighwellness.co if you're in the UK, Europe. Also keep an eye out for our upcoming food and beverage products, including protein-thin snacks. All right, back to the discussion. That's right. And we don't live in fantasy land. We know that not everybody is going to follow through on these things, but it doesn't help, does it, Dr. Ben, when this isn't even mentioned? It's not like, it would be one thing if the doctors and authorities were sort of casually mentioning it and we could say, oh, you should talk about it more. But they're not even talking about it at all. It's incredible.
It's not just that. I mean, think about your last primary care visit. I mean, I've seen people go in and there is actually most people that go in, there's no mention of it. It's what medications are you on? Let's check your blood pressure, your heart rate. And then it's a question about which shots have you gotten, which interventions have you done? And then this tiny slice of time is spent discussing, oh, yeah, maybe some diet and exercise. I mean, that is your standard primary care visit. If any of you have done a wellness exam, a Medicare wellness exam, if you're over 65, you may have done this. You go through an unbelievable amount of questions. I hope somebody here can speak about this in the comments below, but you go through an enormous amount of questions. How many of those are geared toward what kind of food you're eating? Are you getting enough exercise? And does your doctor then come in and spend a lot of time talking to you about that? I bet the answer is no.
Yeah, very well said. And comment down below if you've had a doctor who has talked about, oh, you must get the shot without even telling you any evidence behind it, but has never told you, maybe cut back on sugar. How much sugar are you eating? Are you walking enough? This is what's wrong with the modern medical paradigm. This is why it's failing. Doctors are completely blindsided to this. They are going in a certain direction. Everything is about medical therapeutics, injections. Yes, okay, we can talk about that, but why not talk about the elephant in the room? This must be extra painful for you, Dr. Peter, as a cardiologist.
And you talked about the primary care visit, and that's the last thing. And that's true. A lot of doctors' visits, it's like the last, 30 seconds of a visit. Doctors feel like they just need to talk about it so they can put it in their note, probably for some code or something. But ultimately, wouldn't it be great if you walked in and that was the first thing they talked about? And that was what most of the visit was, or when you're checking with a medical assistant who's asking your medications, like instead of asking all like the stuff that really is just like algorithmic and redundant, is want to ask like, as you check your vitamin D level, what are you doing for exercise, and do a deeper dive on that. And I guarantee you, like most people out there, and you probably realize that when you go to your doctor, no one talks about what you're doing yourself, like how you can be healthier without necessarily pushing medications.
It's sad, isn't it? I'm sure many doctors would like to do the right thing, but they're stuck in the system. This is the problem. Stuck in the system and don't want to think outside the box either. I don't think we should let doctors off the hook, because they're supposed to be intelligent people, supposed to be thinking for themselves. And I don't think it's enough to just say, oh, the visit only allows us 5 minutes. We're not going to do this. What do you think?
Well, that's not doing the best for the patient. And that's what we all go to when we go into medicine is what's best for the patient. And by doing this, we're doing what's best for the insurance company, or what's best for the electronic health record or billing or whatever. It's not really best for you if we don't talk about it. And that is just, it's crazy.
But doctors have allowed it to happen, and they didn't have to. We didn't have to, right? So you can say no. You can say, no, I'm not going to do any of that stuff. I'm going to focus on the patients. And I do know doctors that do that, even in pretty ruthless systems where it's very hard to step outside the box. And I know that they do that anyway. So you can do that. So to say doctors had no choice is not true. Now, the system is overwhelming, and the special interest groups are very powerful. So I can understand the pressure, but that's our job to speak the truth. And if you really don't fully believe in an intervention, and you don't think the data's there, and you're just pushing it because you're afraid someone's going to get you in trouble if you don't, that's inappropriate. And that's not the best thing for the patient.
That's right. Gee, all of this is, I think, making me a little bit worked up as well. Maybe my immunity is being decreased. I need a sip of my chai to feel a little bit better here. But you won't say something, Dr. Peter, but it's infuriating.
It is an infuriating. You have to be an advocate. And I saw this wonderful older gentleman. He was in his early 90s in my office, and he is so fit and so much younger than the stated age, but his primary care had told him that he should go on a cholesterol medication. And in the office, I brought up with him, is that your primary care recommended you to be on it? And he said, I don't want to be on it. And I'm like, well, you should tell your primary care that you don't want to be. It's your body, and be an advocate. And it was crazy to see this really amazing 92-year-old being pushed to medication that he doesn't want to be on. And so this is the bigger picture here is you have to be your own advocate, and one size does not fit all. It doesn't matter just the numbers. You have to treat you holistically as a person, right?
Exactly. And this is a good segue onto the next topic, is individual risk. Now, I have shared my own story regarding the flu shot, and I'll be very transparent. Since I was in medical school, I took the flu shot like clockwork every year because I was told to do it. And this continued until 2 years ago. So last year, I decided, by the way, I had never had any problem with the flu shot. I'm full of transparency, no side effects, nothing, maybe a little bit of arm soreness, but I just took it like clockwork. And I thought to myself, well, here I am as a doctor trying to promote health, well-being, and true medicine-informed consent. Why am I doing something when I know the evidence is not good? So last year, I decided I would put in a declination. I'm not going to do it. And it's paperwork involved, but I did that. And I made a video a few months ago. This might simply be a coincidence. It's my own personal story, and medicine is about personal stories. Last winter was the first season in my whole life that I didn't even so much as get a sore throat. No flu. Now, in the interest of full transparency, I was doing other things, like I was putting more effort into strength training. I was walking outdoors in the morning. I was ramping up on natural antioxidants. I was taking additional turmeric as a supplement, for example. I was taking a bit more care of my diet. So I did do other things, and I will certainly give an update this winter as well as to what happens to me, because I'm declining the shot again. But it didn't sit well with me. I don't think anybody can ever be happy if they're doing things in life which doesn't align with their personal beliefs. And here I was, and I was thinking, look, I'm preaching all of this stuff online, but yet I'm doing something like clockwork because this is what I've always done. I'm not going to do it anymore because I've seen the evidence. It's very weak and I don't think it's doing any good for me. So I decided that I would decline it, and that's what happened. I'm going to decline it. I have already declined it again this year. My own personal story. Now, again, I'm not telling anybody else what to do. I have very close loved ones who look at evidence and they decide they want to take a flu shot. So fine, that's what it's all about. But this gets to a bigger issue of mandates and the ethics behind them. Do they violate the basic principles of informed consent and ethics, especially if studies are showing they're not effective? I mean, it is not enough. Dr. Ben, I want to get your opinion on this because this happened during the pandemic. It is not on the person who is making a healthcare decision to prove benefit or risk and have the authority trying to mandate it, saying, oh, it's not going to do you any harm, just take it. That's so unethical. That's not a reason to do anything.
I agree with that. And I think this is what I keep saying. If you're going to mandate something, make it absolutely forced upon people, they absolutely have to do it, then you have to have extremely strong evidence that without it, you're going to be severely ill or people around you will get severely ill. For example, you have to wear a seatbelt when you drive a car. There is outstanding evidence that if you don't wear a seatbelt and you get in a car accident, you're in a world of trouble as opposed to if you do wear a seatbelt. There's so many things like that red lights, I'm using a lot of car examples. Red lights, you have to stop at a red light because what happens if you don't, you can get in a horrible car accident. There's a lot of data that's protected. If you can show good data that without these interventions, you are going to have a terrible, terrible outcome, then we're having a very different discussion, right? Then you can begin to discuss, this is about everyone being healthy and things like that. But with something that has an effectiveness as low as 20 to 30%, how can you say it's very difficult to have that same kind of discussion? And I think when you're talking about medical interventions and things you put in your body, you're also talking about a very different kind of thing. I mean, we talk about the body as a temple. You have control of your body. And then there's certain things you have to do with it. That is where it gets really kind of complicated.
It does. Very well said. And don't even get me going on that seatbelt example, because we saw that during the pandemic. And I had so many fights online with doctors over this who were saying, well, it's like a seatbelt. Well, no, an injection is nothing like a seatbelt. A seatbelt is something on you. It's completely non-invasive. An injection actually penetrates your body. How could people with a medical degree have that kind of example in mind? It boggles my mind, seriously.
It's true. And it's really just doctors not thinking about the patient. And it's really just, it's an uneducated, really doctor that if they can't tell you why you should get the shot, then it's really questionable of why you're recommending it. I mean, I can tell people when they have high blood pressure, I can tell them things I have hardline evidence to say that this works, that you will be protected or it will help you or reduce your risk of a stroke or a heart attack. But when you tell something is 20% effective but you have to take it, that's like me walking in the room and being like, well, this cholesterol medication is only 20% effective, but since your cholesterol is sort of elevated, you have to take it and you don't have a choice. If you don't, you can't work here or you can't go to this or that. Or if you look at it in those perspective, it's crazy.
Yeah, great example right there as well. Well, we will conclude then. We have been very honest and transparent about our thoughts, and nothing we're saying is not out there. This is all research. Everything we've said is based on research, not on dogma, just saying you have to do something because it sounds good. It makes us feel like we're doing something good. We actually believe that we are being the right kind of doctor here, presenting evidence and saying, well, here it is. You make the decision. Maybe you've got very advanced lung disease and you know that a flu could end your life and you need to do anything possible, even no matter how small, to improve your chances. It's a violation of ethics, in my opinion, when we are pushing so hard. And unfortunately, medical authorities, despite the fact that the federal government has changed, medical authorities, from what I've seen, have doubled down, especially in certain parts of the country. So let's each have closing statements then on our thoughts on this issue. Dr. Ben.
No matter what you choose, and it is absolutely your choice, without question, you have to take care of your body. You have to take care of your mind. You have to be careful with what you're putting into your body, with what you're eating. You have to stay physically active. Other than that, people really can't tell you, I think, what to do. And I would see every doctor that you meet and speak with as a potential guide, not somebody who can tell you what to do. They're only giving you information. It is your decision what you do.
Wow. It's really well said. As a guide. That's why you're an amazing, one-of-a-kind primary care doctor.
Guide.
Fantastic guide. Yeah, I like that. Guide, coach. Dr. Peter.
It's never really anti-medication. That's not what we're getting at. It's really pro-context. So you really have to tailor what is best for you because no one else will treat your body as best as you will.
Yeah, exactly. Well said. And I would second all of that, actually. My views are very clear. I think that mandating something like this is a gross violation of ethics, patient autonomy, informed consent. I know that there are physician leaders among us, sadly, who I consider absolutely ghastly, disgraceful individuals who are looking at the same data as us and concluding that it's okay to mandate. Yes, you can put forward the data, encourage if that's what you believe, give reasons why somebody should do something, but for something like this, you can't mandate. And I really hope that if any healthcare worker out there is denied the right of a declination based on what we've just been talking about in their own decision, and that declination is refused, I personally hope that goes all the way up to the Supreme Court of the United States, because that is a gross violation of ethics, totally unjustified. And behind all this is, in my opinion, a medical establishment that is driven by dogma, that is not looking at evidence. They aren't being true doctors. And don't forget, the medical industrial complex and big pharma are behind them as well. So that would be my thought on this issue, my final thought. Thank you, everybody, for watching. Please feel free to comment down below whether you agree with us or disagree with us. Let us know. We are perfectly fine. We are not like others within our profession who get very angry when people disagree and want to censor. We want open discussion. Everybody is allowed to talk. We have mentioned many times that we would love to talk to any of these establishment doctors that think differently from us. Of course, they don't take us up on our offers. We've interacted with them online. Guess why? Because they know that their arguments would not stand up for 1 second to logic, a logical counter-argument. They already know that. But we're rooting for you to succeed as naturally as possible. Make the right decision for yourself and your family. Get a second opinion. Take everything with a pinch of salt, no pun intended. But please keep going on your health journey. We really want you to succeed. Thank you, everyone, for watching. Check in the links down below for our separate, unique Doctors of Ojai channel and also our natural health and wellbeing store, ohiwellness.com. If you're in the USA, North America, ohiwellness.co. If you're in the UK, Europe, it also includes our organic chai, which we've had a lot of good reviews for. Thank you. We'll speak very soon.